As Nigerian students and educators prepare to return to classrooms after a long closure due to the coronavirus pandemic, the United Nations is calling for caution.
Now, the UN wants the government to prioritize safety and learners' protection. The humanitarian body says a safeguarding education from attack is urgently needed to restore confidence in schools as places of protection for children and teachers.
This, the UN says, will indicate government's commitment to protecting investments in the education sector and serve as a validation of Nigeria's endorsement of the Safe Schools Declaration. There is some sort of argument here as to whether should we reopen tertiary institutions, should we not reopen tertiary institutions, and it's been, almost something in between the government, the federal and government schools, as well as the private universities as well. Should we reopen or should we not reopen?
Well, the debate it's on from the side of those who are stakeholders, which is normal. But however, the decision is very tactical and a difficult one to make, because you're looking at the safety of children and students. How we keep them safe, we have to leave them in the house for them to be safe. And then on the other hand, how long do we keep them in the house? Considering, because you remember we've been speaking with some professionals, medical professionals, who are saying that the rate amongst children is less, the fatality rate amongst children is less than adults, or the immunity for children is higher than the one for adults. So
but children are now contracting the virus as well.
No, so. Of course. But the rate, the number of children comparative to, if you check the ratio and jiggle them against adults, you see the numbers are low.
Right, so let's hear from someone who is in that sector. Joining us is the Director of Academic Planning, Bells University of Technology, Dr. Ngozi Arisa. Good to have you join us on TVC Breakfast. Now,
Good morning. Great. Yeah.
There is a general argument now, among stakeholders as to whether to reopen. But when you look at the state of our tertiary institutions today, do you think that we're at a place where we can reopen?
Well, for us in the private sector, we have actually made a lot of arrangements to ensure that school resumes. We have already put in place all the safety protocols as have been recommended by the World Health Organization. We have water in all, as they're entering the university, we have water for all visitors to wash their hands. We have the thermometers for the visitors and the students to be tested. Then the universities have already made arrangements for all students to have nose mask, for them to have hand sanitizers, personal hand sanitizers for them. The hostels have already been cleaned up, sanitized, and ready for the students to come back. And already, as you're entering the hostels, you have water. In the areas where they eat, that's the cafeterias, we have already put in place wash hand stations for them. Then the university also went ahead, like my university, Bells University of Technology. We have already made arrangements for the students to be tested, not COVID-19 testing. That's as they enter, they will be able to clean up their hands, use their hand sanitizers. In the classrooms, we already have made sure that we will have students half of the capacity that we used to have, half. That's in a class where you had, let's say, 50 students, we've made arrangement that only 30, which is 60% of the students that should normally have accommodated to be there. Then in the hostels, we've already reduced the number of students that will be in the hostel. Like where we had 6 students in large rooms, we've reduced it to 4 students in a room.
So what happens to the to what happens to the remaining students? Because if there's a capacity for 50 students and 50 students are actually in this class originally,
yes.
and then you're reducing the number to say 30, so what happens to the remaining 20?
Okay, the remaining students, we've used timetabling.
Okay.
We use timetable. So where the lecturer would have had, let's say, 2 classes in a week, the lecturer will now have about 4 classes in a week. So we've used timetabling to ensure that everybody is accommodated in when they will come back. So there will really be no problem, because already even the National University Commission has sent some forms for the universities to check, to fill, and tell them how far they are ready for the students to come back, which most universities have already responded and filled and told them that this is our state of readiness. So it's just left for the government to say that students should go back to school.
All right, so we understand that private universities are putting all of this in place.
Yes.
But when you look at the number of students in the federal or government-owned universities, for example, in a lecture theater where you're supposed to have about 500 people, you have sometimes 1,000 students, some hanging in the windows. So you can't really you can't avoid contact. So what these stakeholders are saying, government should have a meeting with all stakeholders, whether in government or private universities, and then before a decision can be made. Do you think that that's the right thing to do at this time?
Yeah, it is really right, because for the government-owned universities, they still have to put in place all these protocols to ensure that students will come back, and that will entail that they also use the timetabling system that I have explained before to ensure that they don't have overcrowding in the classrooms when students eventually resume, because it should be something that should be ongoing. It shouldn't just be a one-off thing. It should be something that will keep going on, that even after they come back, we will not immediately allow them to converge the way they used to. So they will be coming in bits until things normalize.
All right. Thank you so much, Dr. Ngozi Arisa, for your time on the program. We wish you well in what you do there. Thank you very much.
Thank you.
Right.